Hi, today I'm going to talk to you about lumbar disc degeneration. My name is Roxanne Meldrum and I'm a physical therapist with PT Health Academy. Again, my apologies, I am not a very good illustrator, but I'm hoping that these diagrams will show you a little bit about what happens when you have degenerative disc disease, which many people are labeled with this disease. This on this side is a healthy vertebrae disc vertebrae segment. So this is bone. And in the middle of the purple, this is a nice, fat, healthy disc. Now, normally, this disc will compress a little bit, allow for a little bit of motion. There's only a couple of degrees of motion between each bone of your low back levels. When we take an x-ray of a spine, part of what we look at is the space between the two bones. And if the space is preserved, we know how much space there should be. If that space is preserved, then we assume that that disc is doing pretty good. It's staying pretty healthy. On the contrary, when we look at a spine that is struggling, when we do an x-ray and we see that space between the bones has narrowed, we can make the assumption that the disc is no longer fully intact and functioning, that it's experiencing some changes. And what I think is interesting about the changes that the disc undergoes is, just like we talked about yesterday with the knee and how the ligaments on the sides of the knee check motion in a healthy knee, and then in an arthritic knee, those ligaments are then on slack and can no longer do their job as well, the same thing happens in the spine. When the disc is robust and thick and fully functioning, there's not a lot of motion between the two bones. There's enough, but not too much. And in a spine that has some degeneration, now we see a lot more play between the vertebrae. There's a lot more motion in the bones in relation to each other. In fact, we grade disc degeneration on a scale of 1 to 5. And 1 to 4 is characterized by an increase in this kind of motion between the two segments. And I think this is important to understand because this is one of the reasons why I'm very concerned when we use stretching as the primary treatment for low back pain. Because we already know that the disc is struggling with extra motion, so adding more motion to that is not helpful. Unfortunately, in the short term, stretching can give us some good symptom relief, but in the long term, we are continuing to stretch on this disc, which is already showing signs of increased mobility that is not helpful for our spine. Again, this sounds very doom and gloomy, but I want to tell you that the miraculous thing about our body is that we can show some pretty horrendous changes on X-ray and MRI and not necessarily have symptoms. So if you do have symptoms, there is always help to help those feel better. As a physical therapist, what I would do in this scenario is I try to teach more stabilization, controlling for that extra motion as you build strength and address any of the other impairments leading towards why this is happening in your spine. I hope you found this helpful or interesting. If you did, please like and subscribe. It really does help my small business grow. Thank you so much for listening.